Over the last couple of years, we've seen a lot of media hype negatively portraying HA fillers, and we all know that the fillers last longer than what we all thought they would. So have you experienced the same downturn in the amount of filler volume, and how's that impacted your practice?
I still buy a lot of HA and Radiesse because those are my key ingredients for penile augmentation. And you still need HA filler for lips. A lot of Sculptra, a lot of Radiesse, but there's certain areas I wouldn't want to inject Radiesse, maybe Sculptra or HA filler, all right, like the piriform aperture or even the temples, the forehead. So there's still need for the HA fillers in my practice. And, I love contouring with it, particularly cheekbones, mandible, chin, immediate gratification. You can't get that from Sculptra. You can get that from Radiesse, but, some people don't want Radiesse. But there's still a big role in my practice with HA fillers, except that I prefer to inject it deep because I just feel like bone sets the tone, right? And the issue is the tissue. If you inject a little bit too superficially, sometimes it could weigh down the skin, all right? But however, if you're really kind of reinforce the bony structures, I think you're going to get more bang for the buck.
Yeah, I did a masterclass this weekend with Tom Van Eyck, and he explains in his practice that he either injects dermal filler in the dermis, like very superficially, or on the bone. He doesn't believe it should live anywhere in the middle.
In between.
Yeah.
Correct.
And,
that's how I am too.
Yeah, you see a lot of the problems with nodules, a lot of the ultrasound work that some of the ultrasound gurus have done, is because the filler's sat in the muscle. And it's kind of in the wrong layer, and an area that moves a lot, it seems to irritate either the immune system or the filler or both, and that's where a lot of problems seem to be coming from.
Yeah, and then speaking of Tom Van Eyck, the Fern technique, you have to have HA filler for that. And I did a Proceris crease like two nights ago, and I used a high G prime filler, to just give the dorsum a little bit more of a ridge. And then I injected superficially with Bellatero Balance, kind of like a pseudo Fern technique, but also blanching to really fill in that crease. And it turned out beautifully. And, you need the HA for that.
Yeah, I think we can all agree that we still need HA, just using it better. So how do you explain this filler anxiety and what's being discussed on social media with the surgeons, etc., to your patients? This is something that injectors really are struggling with at the moment. I probably have this chat at least 3 times a day with people. So how do you do it?
It's just so funny because when the patient comes in, it's like, I want to look natural. Oh, because you asked, I'm not going to make you look really artificial, like alien-like. Thank you. All right, now that we have that clarified, right? But like, I showed them my body of work, all right? This is what I produce. It's kind of that undetectable, but you know there's something there. There's improvement, but it's kind of like you only better. That's like the motto. But yeah, they're just terrified about looking alien, like with the big lips, etc.
Yeah, I think the patient's perception is both, set by what they're seeing on Instagram, but also sometimes it's just wrong. Like they'll often say, "Oh, I don't want to look like this," and they do this weird face, and you're like, "Well, of course not. I don't want you to look like that either." So we're on the same page here. But their perception of what we offer is sometimes warped. Mm-hmm. But they do see weird results online as well. So it's a bit of both. It's real and myth.
Well, you'll only notice something that looks unnatural, probably. So it's kind of like, unfortunately, that's what people are going to. The untrained eye gets exposed to the bad work.
Yeah, it's like and I also tell them it's going to take a lot of filler to make you look that ugly, right? We're only talking about 1 to 5 syringes.
Yeah, that's a good point. So are there any products or techniques or things like that in aesthetics that you think are bullshit? So we've had lots of people who have, argued for and against lifting threads. That was something that was sort of common on our injector diaries years ago. But what do you think's not quite worth the juice?
On board with the PDO threads, I was one of the first providers in Canada doing that, one of the first ones to stop, just because it was so hit or miss. And sometimes I'd have to save the work with filler. So was it the threads or was it really the filler? But now in Canada, we have something called Aptos, and I think it's giving great results. And it's very promising. I've only had a couple patients so far, and I'm still really trying to figure it out. But in terms of other things that are pertinent, like PDRN, the exosomes, the PRP, it's being thrown around a lot, and I just really don't know what the difference is between them.